All right, everybody, welcome to the Personnel Committee of Albany County Legislature, September 26th. I'm your chairman, Mark Grimm. To my left is Lynn McCackis, the vice chair. And I'd like to call the roll if I could. Sean Moore.
Here.
Rick Touche.
Here.
Ray Joyce. Allison McLean Lane.
Here.
Lucille McKnight.
Here.
Lynn McCackis knows. Okay, Joseph O'Brien.
Here.
And Travis Stevens.
Here.
Barely here.
The first order is to approve the minutes. Has everyone had an opportunity to review those?
Is that
Does anyone have any questions?
That's it?
Does everyone have the agenda? We're all set there?
Got it now.
Okay, any questions about the minutes?
Motion to approve the minutes.
Mr. O'Brien, seconded by Mr. Touche. All in favor?
Aye.
Opposed? Unanimous. Okay. Under previous business, local law F regarding anti-nepotism policy. Is the sponsor here?
The sponsor is here.
What's that?
We're in bed out of order or no?
Okay, well, I'm going to let him go first because he was delayed in the other committee meetings, so I don't want to delay it this time, then we'll get to the nominee, okay?
Membership has its privilege.
Mr. Drake.
Okay, thank you, Mr. Chairman and Personnel Committee. I bring this back to the committee, having experienced a public hearing earlier this month. The public did not have any comments upon the legislation, so I open the floor to you for questions. Tonight I'm seeking to move this out of committee to the general legislature.
Questions from members?
If I remember right, the last time we did a pay equity study, it took quite a while and was quite lengthy. So how do you anticipate you're going to do this really a quick turnaround?
Oh,
Did you see the last one we've done?
this is the anti-nepotism policy?
Oh, nepotism, I thought you
Number
said
one?
pay equity. Okay, well, I'm moving fast. Okay, go ahead. I'm sorry. I'm ready for you though.
All right, any member questions on this?
Anthony.
Well, I still believe that we have an ethics
Ethics.
law
Issue.
that addresses this issue, and we're all bound by that law. And I believe that, while the intent of this law is honorable, we are asking family members to go through hoops that nobody else has to go through. And I believe it, I'm not a lawyer, but I said it from day one. I'm not even sure if it's constitutional to make them go through those extra steps to apply for a job. That's my opinion.
Okay.
Everybody's entitled to one.
Did we get an opinion from the lawyer?
County Attorney?
County attorney, we
We
asked
have,
for.
yeah.
Do you have a copy of it? Because we asked for that in this committee.
This is months ago we got it.
Where is it on the back here?
Mr. Ward, has brought up his objection a number of times, and I take it respectfully. This is, however, just to clarify, the local law is a modification of the ethics law, specifically adding paragraph 10, nepotism, and then renumbering the paragraphs therein. So the only real new piece here that again, referencing the ethics law that is already in place, we're just modifying it to include this language and to carry on the good work that was intended to do. Also, just to remind everybody that this law does not apply retroactively, and that is the section 2. The entirety of section 1 is the modification to the ethics law, section 10.
Okay.
And section 2 of this law that I proposed is it will be effective, that it will not be applied retroactively, and that individuals who were hired by the County of Albany on or before the effective date of this local law should not be impacted, which also includes anybody who might be reappointed or rehired on term limited jobs. Of course, again, even if the legislature were to approve this, this requires public referendum in order to become law.
Okay, do we have a motion?
I'll make a
I'm sorry,
motion.
just one point just to clarify for the committee. The original submission of local law F, there was a request for an opinion from the county attorney. The county attorney returned that opinion, I believe, 5 or 6 months ago at this point. That was what prompted the changes that Mr. Drake has put in for this version, and there's been no county attorney opinion on anything since.
make
Mr.
that
Stevens, your motion is to move it to the floor with a favorable?
Favorable, if
Okay.
it's tolerable by everyone.
I just want to state for the record, I believe it's time for this to move to the floor. I would vote if we took no recommendation on this.
No
I would vote
recommendation's
to-
fine.
I wouldn't vote to move it to the floor with no recommendation, otherwise I'll vote.
No recommendation's fine.
Mr. Stevens recommends it, moving the floor with no recommendation, seconded by Mr. Ward. Okay.
Certainly.
All right. All right, all those in favor? Aye.
Aye.
Opposed? It's unanimous.
Thank you very much.
Mr. Drake. Thank you, Mr. Ward. Okay, I'd like to take the fifth item out of order, if that's okay with everyone. We have confirming the appointment of the Commissioner of the Department of Aging. Are there any objections to taking out of order? Okay,
We're going to confirm it here? Or take later?
right
Okay.
now, yeah. If it's no objections, yeah. Go
Different.
ahead.
Well, we'll do it later, yes.
Okay.
It's got to come out of.
Come out of
There's a
committee.
handout that goes along with this.
Here you go. From the Human Services Manager. And you have the five.
I'll just give everyone a chance to look this
There
over.
was a job description.
We said
Given Clement having feet to it. This is not, I'm just saying, but that's a question you want to ask. I can if you want to.
Okay. Ms. Lukakis? You have a question? Before we do.
Just before we get going, I was wondering if we were provided with a job
Sheldon's
description
Schenectady.
for our request.
Should you be able to speak to this?
Well,
The Commissioner of HR has provided us with a document regarding the responsibilities. However, there is a bit of nuance to this. If Ms. Clement wouldn't mind.
The jurors class for that position is unclassified, and therefore a job spec was likely created just for the sole purpose of advertising and drawing in candidates that were qualified for this particular job, but the position does not have an official civil service job spec.
Does everyone have now this? Yeah, take a minute to review this.
oh, she's here for this. Yeah, whatever.
Thought I recognized the last name.
Okay, are we ready to proceed? All right, the nominee is Deborah Rotano. Welcome to our committee, it's nice to have you. Let me start out with, I think, an important question is, what do you think the challenges are that you would face, and how would you propose to meet those challenges?
Well, you caught me off guard because I was going to give you an opening statement.
Oh, okay, no, if
That goes on
you
the
prefer to do it,
confirmation.
that's fine.
And I wanted to do that before my hair curled.
Oh, go ahead.
Well, first of all, let me thank you for meeting with me this evening to discuss the aging community. I am also grateful to our county exec, Dan McCoy, Phil Calderon, Chris Quinn, and all those who have already started this conversation. It's an amazing opportunity, and I have to tell you, a humbling one. If you live long enough, you have lots of experiences and have a network of collaborators. I have worked with communities that have been marginalized because of poverty, hunger, racism, and ageism. My work with senior citizens has touched just about everything you can imagine. I have built programs, run senior centers, helped create a one-day senior center in West Hill, and I've advocated for policy like safe handling of patients, letting seniors in particular know at the hospital that they were under observation status so that they would know their insurance wasn't going to cover them. I've taken seniors on trips to help dispel isolation and trips that continue their educational experience. For example, I took seniors to DC to the World War II Memorial and the Holocaust Memorial. I've created an intergenerational program while out at the NORC which is a naturally occurring retirement community, which is a specified area of Albany. Students from Albany Academy for Girls interviewed and recorded the life experiences of seniors. Students helped seniors with computer skills. The College of St. Rose did a program at Newark helping seniors use their cell phones. There are probably, and I'm not sure about this number, I'm guessing, about 75,000 seniors now in the county, including the boomer generation that also is sandwiched between caring for elderly parents and grandchildren. While at the Newark, I coordinated programs on Social Security, healthcare, and Medicare, had their assessments reviewed with the assessor, arranged flu clinics and eye exams. I arranged the CARFIT programs, political debates, meetings with other officials, enjoyed tea, and visited and sat by the bedside of residents who were dying. I have chaired or co-chaired many aging commissions and worked in the Newark neighborhood to have neighbors help neighbors in small ways and big. The Newark model, along with the village movement, is the latest innovation in aging. The Newark provided much to a distinct area of Albany. I was part of the complete streets count, assessing walkability for seniors and safety. And yet there are still so many areas to cover. I know what I know, and I also know what I don't know, but I know how to get that. So I am very grateful again to the county. I'm not shy about asking for help. What do I think is a big challenge? I think one of the things that we haven't, that needs probably more attention is that maybe a series of charrettes with the African American community to be able to assess the needs of seniors throughout the city, because it does vary, as I am learning from that one-day senior center that we have on Tuesdays over in West Hill. I think that's important. I think reaching seniors that are LGBT, that was driven home to me by a senior that I had in the Newark area, who now was in his 80s. He was adopted at birth. He was abused as a child, had nobody, was part of the LGBT community, but you know, at 80 and 85, that generation was not able to come out. And if you know anything about LGBT community, you know, somebody is, you're coming out every week, or you're coming out in a different way. And this gentleman taught me a lot about that, and how sometimes every organization that deals with senior citizens and every committee that I've been on, we've missed the boat on that issue. And so I see those as possibilities in advocacy and reaching out. That was a long answer to your question, sorry.
Okay. No, is there anything else other than that?
No.
That's a challenge?
No.
All right, let me just say, the adopted budget line item for this salary is $93,116 in the 2018 budget. $93,000. Any questions from members? Okay.
I do have a question. I see the address states that it's 1203. Is that Schenectady? Zip code?
No, 12203 is Gilderman.
It's Gilderman. Okay, good, thanks. Gilderman, okay.
Ms. McKnight, you done?
Yeah, that's all I want to know. Promote residents.
Greetings, Commissioner Designee, thank you. I come from the town of Colony, where 38% of all the seniors in Albany County live. And I heard you talk a lot about advocacy for the inner city and for tender populations. But in my district, when I went door to door, I was unbelievably shocked by the amount of shut-in and homebound seniors we have in suburbs, and supposedly affluent suburbs. Taking what you know and what you have done, and recognizing that 38% of the seniors are in the town of Colony, where we do have good town senior services and we have a great not-for-profit, how do you see Albany County reaching out and presenting its programs to the biggest chunk of seniors in the county?
Well, I see that as an easy fix. I mean, I've worked with Chris Carey frequently. I'm on the Senior Issues Forum with her, co-chaired with her. The village movement is becoming very, very popular. I mean, I don't know how much you know about that, or they're part of it, Colony is part of that. They tried to put a NORC, they wanted to put a NORC in Colony. NORCs have a lot of federal regulations. You know, it could be, we had, in Albany, it's a 2.2 square mile area. You can't include apartments that are more than 5 stories. There has to be 40% density of seniors. I think Colony does a superb job, actually, with what they do. When you go door to door and you find them, find people, that's, that needs to come to Colony, and then there needs to be a good collaboration with the county so that, we can address whatever those situations are. I don't know how many of those people get home delivered meals.
Those are numbers that you will have access to.
I am sure, yeah.
And I guess what I'm asking you is, please focus as much on the 38% of the people that are in one community that right now are not really aware of so many of the county benefits and different programs and pots of money. That's what I'd just like to ask you to do.
Yes, absolutely. My mother lives in Colony, so I know the situation. Thank you.
Mr. Stevens?
And I also would ask you not forget the rural Albany County and the hill towns as well.
No, absolutely not. And I have a senior who is actually in Greenville who is now really kind of shut in, but she accessed the lunch program there. And, it closed up and then it opened up again, and now she's not able to get to it any longer because she can no longer drive and she's ill. But the hill towns do a great job, and we work with them as well through the Council of Churches, through the churches that are there. I'm currently the executive director of the Capital Area Council of Churches and have been for the last 5 years. And our outreach is big. There are 91 churches that belong to the council. They're a great resource when you're talking about being able to do things like being able to put together a senior center without walls, so that when you have a good collaboration, usually with the churches, because they'll lend out their space, you can move your programs from Colony to Guilderland to the hill towns, because they're already on board, the folks there, and so I wouldn't forget them.
Thank you.
I'll just underscore, of course, Guilderland feels the same way as my distinguished colleagues do. So it's important to remember that the County Office of Aging serves everyone in the county.
That's right.
And that's worth underscoring. Any other questions?
Yes, I'd like to know your experience with working with the county's long-term care council. In what role?
I worked with the Long-Term Care Council in Schenectady years ago. Not so much with Albany. Through the NORC, that was headed, although I ran the NORC, it was actually the executive director of Jewish Family Services who worked with the Long-Term Care Council. It was not my role to step in there.
Okay.
But I was chair of the advisory council in Schenectady.
Okay.
Anyone else? Is there a motion? Mr. Joyce?
Second.
Mr. Touche, second. All in favor?
Aye.
Opposed? Unanimous? And congratulations and best of luck, and let us know if we can ever be any help.
Thank you. I'm coming to a town near you soon.
Yeah, we're looking forward to seeing that. Tell me about that.
Thank
We'll
you very
sponsor
much.
something for seniors.
This was done wrong.
Okay, back to item 2. Pay equity study for
Have a
employees of Albany
confirmation
County. It's
hearing.
Mr. Fine here. He's not present, okay. So we'll table that. 3,
Table.
voting on Albany County employment and diverse workforce requiring civil service to conduct outreach and training. That's also Mr. Fine, isn't it? That's correct. Okay, tabled again. Item 4, current business, approving the Department of Residential Healthcare Facilities collective bargaining agreement. All right, our nursing director, Mr. Slavsky. Any opening remarks?
Yes, this is an agreement that we've been working on for the last 5 to 6 months with NYSUG, the union for the professional staff at the nursing home. This is a 5-year agreement that's retroactive to January 1st, 2018, and will be funded the amount of $87,141 within the budget of 18 utilizing vacant positions. And we have put in the amount in the budget for 2019 to cover the additional expense of this agreement.
I have a question from the raises. Increased by 1% plus an amount equal to 1% of the cumulative total of current and active bargaining unit employees' salaries divided by the total number of current and active members. That sounds a little bit about my trigonometry. Can you explain that?
I'll explain what we did here. And it really was with the cooperation of the staff that work at the nursing home. The higher compensated professionals at the nursing home realized that there was a disparity between the lower paid individuals who also happen to be a NYSUP but professional in the sense of their job title and being in the NYSUP union. They felt it was important to give up part of their increase and assist the lower paid people to bring them higher up to where they're earning. So what they did is everyone got 1%. Then we took what 1% would be worth if everyone, what that 1% raise would be worth. And then we divided it amongst those active staff members on the payroll in NYSUP. So by doing that, everyone got an equal amount of the 1%, but it was a higher amount for the lower paid staff members who were in NYSUP.
So
And
is
that's
that-
going to happen in 2018 and 19.
Okay.
Yes, it's no more money if the body is wondering that. It's basically taking 1% of the total pool and giving everyone an equal share, and then a 1% on top of
Right.
their own raise, of their own salary.
Right, everyone's
So they
getting,
are
Well,
sharing.
some get more than 2 and less than 2 then?
yes.
Yes.
So it's
The
a
older one, they
2%
agree to
raise.
that?
It's a 10% contract, 2% a year over 5 years. However, the first 2 years, the 1% is divided amongst all active staff members, and they're going to get that increase. So therefore, the lower compensated staff members are going to get a higher increase. So that's correct. Some people may get 2.25%, while a higher compensated staff member will get 1.75%.
Oh, wait, so it's still 2% for everyone if you take the total salary, which is
Correct.
typical of other agreements.
Identical.
But in-house, apparently there's this willingness for people to kind of share a little bit with the little guy.
It's a very nice thing that they're doing.
Okay. Any questions from members? Motion by Mr. Joyce, seconded by Mr. Ward. Ward, all in favor? Aye. Opposed? Unanimous? Thank you.
Okay, thank you.
Okay, motion to adjourn. Mr. O'Brien, seconded by Mr. Ward, all in favor? Aye. Opposed? Adjourn, thank you.